particular approach to medical education came about from a presidential study commission set up in motion by President Eisenhower almost 7 years ago and was implemented in 1963 by legislation providing the matching money. It is quite probable that increasing funds will be available in coming years to support not only construction but the operation of new medical schools. It has been emphasized that existing schools to be eligible for these funds should expand in certain proportions specified by law, and that funds should go to new schools as well. The matching funds also provide 3-to-1 matching funds for schools of public health, so that we see that there is a very great federal interest in health education, and that this interest is going to become even greater as time passes.
Thank you.
It is certainly true that the training of the physician alone is not enough to meet the health needs of our people. Not many years ago, the health needs as they were met more or less by the physician acting solely on his own. The physician, by and large, simply was able to diagnose the condition, and in most cases there was little that he could do except to commiserate with the family, to be sympathetic, and to act as a good friend and companion. The advancements in medical science have made the physician capable of providing much more, but they've also provided helpers to go along with the physician, the so-called allied health team. So that today we have the physician working in concert with nurses, public health people, technicians in all sorts of new areas, and new fields are opening almost daily to provide better health services for the people. Today, the physician no longer acts as a sole purveyor of health care, but is in a sense the leader of a large and even expanding health team. Whereas many years ago, the ill would become ill rather suddenly and in many cases would die in a short period of time, today we're faced with more chronic, more disabling, and more expensive disorders that involve the services of many more people. For example, the blue baby situation years ago required only a doctor to make the diagnosis and to sympathize with the family over the impending death of this child. Today, 20 and 30 persons are required not just to commiserate with the family, but to cure this particular condition. So that while we're having automation in some fields eliminating jobs, every expansion in medical knowledge creates many new job opportunities and many additional opportunities for service to the sick of our nation. Ball State is in an excellent position to provide services in the allied health fields. Many programs have existed on the Ball State University campus for a number of years, almost 36 years, particularly in the area of nursing, where a 4-year nursing program existed almost from the onset of Ball State's affiliation with Ball Memorial Hospital. Many other programs exist, 3- and 4-year pre-medical and 3- and 4-year pre-dental programs, a medical technology program, dietetics programs, occupational therapy programs, and speech and hearing therapy studies and programs. All of these are of great importance and are current ongoing programs. The caliber of these programs has been demonstrated by the capacity of the graduates of these programs to function effectively in other areas and other universities. Recent visitations by a number of out-of-state medical school deans was very helpful in assessing the potential new programs that might be easily added to Ball State's already strong scientific underpinnings. The deans were most impressed with the leadership at Ball State University in the health sciences and sciences areas, and the current expanding facilities for research and paramedical studies in the new $8 million science and nursing complex. Again, emphasize how much Ball State University can do with its affiliation with an adjacent 645-bed community hospital, its years of cooperative affiliation on many levels with the community and with the area. Ball State has been working rather actively toward the project of establishing a new medical school for about 3 years. This activity began shortly after the statement by the late Dean John Venice of Indiana University Medical School that the state of Indiana needed an additional new medical school. The realization that medical education is a part of higher education and would have to be carried out to be done effectively in a university setting led the responsible authorities at Ball State and in Muncie to consider the potential of Ball State in contributing to this type of program. Actually, the contribution, the work in this area goes back many more years indeed. Perhaps it could be said it has gone back to the original contribution of the Ball family that made possible the gift of Ball State University to the people of Indiana and the Ball Memorial Hospital to the people of Delaware County and the eastern Indiana region. This provided a unique opportunity for the establishment at some future date of a College of Medicine, and it has been suggested that this may well have been in the minds of Mr. Frank Ball and his very distinguished and generous brothers when they provided these two unique philanthropic gifts to the people of Indiana. In recent years, we have had a number of distinguished medical educators, deans of medical schools at Duke, University of Pennsylvania, University of Arizona, Michigan State, Stanford, UCLA, and other schools have visited the campus at Ball State and have almost uniformly been tremendously impressed by what Ball State University had to offer to a new College of Medicine and to providing better health educational facilities to the people of Indiana, not only from the standpoint of educating physicians, but in providing total support with the entire health team. There are many important advantages to be gained from locating a second School of Medicine at Ball State University. The most important of these, of course, is that the medical school will be a part of the total higher educational picture. The medical school will be within the framework of the entire university, will be an integral part of Ball State University, both geographically, philosophically, as well as administratively. Among the advantages include the existence of an adjacent 645-bed community hospital, which can serve effectively as a university community health center from the standpoint of educating better family doctors for the future. The location from the standpoint of population is also important in that Ball State serves a very large area of northern and eastern Indiana with a population well in excess of 1 million people. An additional factor to be considered, of course, is the comparative closeness to the medical school in Indianapolis. Although this is on the west and south side of Indianapolis, it is near enough to provide consultation, faculty interchange, as well as student interchange and guest lectureships. In this way, a number of expensive items of equipment and areas of duplication may be avoided by providing cooperation with the existing School of Medicine, and that these schools, again, cooperatively may facilitate the establishment of the needed new medical schools beyond the projected 2. Of all of the considerations in locating a medical school, it is certainly quite true indeed that the most important single consideration is that the medical school should be located physically on the home campus of the parent institution. Medical education is a very sophisticated and complicated part of higher education, and it can be carried out certainly most effectively only in the total university setting. This is true because the medical school, in an age of expanding science, of burgeoning health needs of the people, is in greater need than ever before of the total university support of the social sciences, of the humanities, the entire scientific complex that only a university campus can provide. Intellectually, it has been stated for many years that medical education belongs in the university setting. This was emphasized many years ago by Flexner, whose report revolutionized medical education in the United States shortly after the turn of the century. It has been recognized even more in recent years by the recommendations of national authorities, by the almost unanimous opinions of deans of medical schools, that the medical education belongs as an integral part of higher education on the university campus. Stanford University trustees realized this a number of years ago when they gave up a very expensive medical school, hospital, and center in downtown San Francisco to move to the home campus in Palo Alto at the cost of many, many millions of dollars. The state of California itself has recognized this. Its first medical school was located at some distance from the home campus in Berkeley, being in downtown San Francisco. The second medical school established by the state of California was located on the home campus at UCLA in Los Angeles. The three new committed medical schools in the state of California are all being located as a part of the higher educational picture and on the home campus of the parent university. Ward Darley, Emeritus Director of the Association of American Medical Colleges, has stated that he did not wish to see any new medical schools come into existence that would be located physically separate from the home campus of the parent institution. I think as we look toward the expansion of medical education, it must be kept a part of the total university picture.